My name is Cheyenne Rincones, and I'm one of the medical directors with Dr. Aviles, and we own Bold Beauty Health and Wellness. When I was in college, I remember wanting to ensure that I picked a profession that allowed me to show my empathetic nature. And I had one cousin who was 10 years older than me that was a nurse, and I thought, that sounds like a good field. I think I'll go ahead and do that degree. And so I went to UTEP and obtained my bachelor's. I graduated as a registered nurse with a bachelor's at the age of 22. And so I worked a lot of hours in the hospital setting to kind of really get the feel for what nursing was all about. And in doing that role in both psychiatry and medical surgical background, which was a hospital setting, I started to see that patients had a lot of language barriers to understanding what they were supposed to do once they were discharged from the hospital, and really didn't understand what their discharge plan was upon leaving. And these were chronic conditions that if they did not understand what the condition was and what they were supposed to do with it, it could potentially lead to a rehospitalization or a flare of their condition. So a decade later, I decided I wanted to go back to school and get a master's to be a nurse practitioner. I thought in obtaining another degree that I'd have a little bit more control on barriers that I saw in navigating patients through care. And I obtained in 2013 a degree as a family nurse practitioner through Texas Tech. So people are surprised when they find out that I speak Spanish. And those that have known me a long time know that my dad is from Juarez, and I grew up here in El Paso, actually in 5 Points here in Central. That helps me to really know the culture inside and out of El Paso and be able to serve the population the way I do. Because I was ranked the highest in quality outcomes, which are blood pressure control and diabetes control, I was given the opportunity to go back and do my doctoral studies with a timeline of 5 years. And I was nominated by other physicians in the department to be in the position of medical director, which is historically only a position held by medical doctors. Once I had been practicing primary care for a while, I started to have patients ask if I did Botox and PRP and other services that they were interested in, as they trust me with their care and wanted to know if they could get that service from me. That led to me starting Bold Beauty initially as just a med spa to be able to do those services on the weekends when I wasn't practicing primary care. Eventually that led to merging both the primary care and what's really lifestyle and regenerative anti-aging medicine. The way that aesthetics fits into primary care as a concept is once you start feeling healthier from the inside, you want to radiate that on the outside. Our tagline is live healthy, look radiant. And that's what we try to do. Our unique approach to Bold Beauty Health and Wellness was to have everything in-house, whether it's lab work that we need or the primary care part, preventative medicine, medical aesthetics, hormone optimization, medically supervised weight loss, mental health and wellness, regenerative medicine, and I hope years down the line is going to be the norm and the standard everywhere in the United States, especially in the El Paso community.